right, specifically working now with, again, scar tissue or trauma that has happened from knee surgery. There will always be a build-up of collagen, okay? So again, scar tissue that forms in the body after some sort of surgery or trauma that has been had. Now, we have to understand that this tissue is very much a build-up of collagen without the elastin component of fascia. The good thing is that we can work with it. We just want to start to apply pressure to the area where we have this band of thick collagen or a band of adhesion or band of scar tissue. Very similar if we've had a C-section, there is going to be a lot of scarring down the front, which is going to be pulling the body inwards, creating pain into the lower back. Same deal with knee surgery or hip surgery, things like that. There's going to be tight tissue that is gripping and grabbing onto the bone with a 20 pound force per square inch grab onto the bone, which is going to pull other areas of the body in and down and create pain across the body. So what we're going to do is apply direct pressure. Again, the most important thing is that you can breathe here. If you can't diaphragmatic breathe while you're applying the tool to the scar tissue or adhesion, you need to choose a more softer tool or make sure that you move it around or use your hands so that you're not putting the body under tension. The main thing is you don't want your nervous system to lock up. It's so important that you diaphragmatic breathe, help your nervous system stay in a ventral state while you're releasing scar tissue and fascia. So that looks like this. We're coming down into our belly. We're trying to access that direct area, that really thick band of tissue that has formed from the surgery onto the knee. Using your forearms as a lever, okay? So just allowing your forearms to come onto the ground and you're unhooking the toe if you can, and you're just allowing the body to melt over that area. Now, I can also bring myself up a little bit if need be like this by pushing into my left shin to apply less pressure to the area. Or alternatively, my left knee can go out to the side to help support. Now, we want to stay here again for approximately 3 minutes. So in through the nose, the belly expands. And out through the nose, and the belly pulls to the spine. Once again, it's that diaphragmatic breath that creates heat, okay, energy and blood and oxygen to move to the area that we are working with in the body. Once again, we are trying to stay there for approximately 3 minutes at a time because you can't rush melting tight tissue. It has been years and years and years of tissue that has formed. And again, the body gets used to what it gets used to, meaning that it loves homeostasis. It doesn't know the difference between good or bad, especially when we're looking at posture. It just knows what is practiced, okay? But the cool thing is with our bodies is that they always want to return home back to their natural state, which is the fascia in a more elastic and hydrated state. So as you start to apply pressure to the area, starting to apply that blood and oxygen and heat to the area, we slowly over time start to dissipate that tension, get more blood and oxygen in there, and it starts to migrate back to its more original state, which is more that collagen and elastin to create better flow into the body as well.